C25 Today.
Welcome back. Well, a new method for detecting breast cancer is now being implemented at a local radiology clinic, and there are several of them, but a new one just opened. They had a branch in Saginaw Township. Joining us from RMI is Dr. Randy Hicks. He is with the whole group of RMI clinics. Are all, how many of them are there?
So we have 6 in total.
6, but
yes.
the new one just opened, Saginaw Township. Tell us this, it's called the Ultimate Mam. What is that?
Correct. So what we've done over the past 5 years is tried to help the actual population of women understand their own care. And in doing so, we're trying to challenge the group of people that come in, the women that are getting their mammogram, to actually understand 2 things: breast density, meaning how dense are their breast patterns, and number 2, what is their lifetime risk of developing breast cancer? Recognizing that 1 in 8 women in the United States are going to get breast cancer, that doesn't mean that the woman who's having her mammogram today, that particular woman has a 1 in 8 chance. Her chance may be 1 in 4 or 1 in 2, and she may not even know that. So we are trying desperately to teach them all these things while they're at their appointment to do their mammogram.
And how's it going out there? I mean, is this becoming a larger problem, have you seen?
Yeah, so when I started practice, I mean, you know, maybe 1 in 10, 1 in 11 women had the chance of getting breast cancer. Now it's down to 1 in 8. So that's 12.5% chance of getting breast cancer. So if I put 100 women in the room, 12.5 of them are going to have breast cancer at some time in their life. So it's a very big problem.
Now, how can you detect yourself? Is there something you can do at home? I mean, how do you, or is this mainly in the office?
So it's, yeah, so mammography is excellent and does a great job. The challenge has become one of early detection. So early detection does include self-palpation at home, but the imaging is very important. So mammography has been the key role in early detection for many, many years. However, new technology with ultrasound and MRI added to that armamentarium, we're actually able to help women of variable degrees of density. So when we talk about breast density, we recognize that the women who have very fatty breasts do a great job just using mammography. However, the women with very dense breasts, which you may not even know, those women need added technology such as ultrasound or MRI.
This must be difficult for you to have to tell a woman that she has cancer.
It is. I mean, it's a very challenging thing, not only for the woman, but the family, and it involves the entire community, really. And it's a really heartbreaking thing, and I think that a lot of people are challenged. But if we can detect it early, we can cure those cancers today.
What about men? Do you see any men that have breast cancer?
Male breast cancer is, while uncommon and less common than female cancer, it is something that happens. So if you're a man and you detect a lump in your breast, you should actually come in and see a physician and get that checked.
All right, doctor, thank you.
You're welcome.
Coming
Thank you for
in
having
this
us.
morning, Dr. Randy Hicks from RMI, and you can contact him and check out the Ultimate Mam. And they just opened that Fashion Square Boulevard in Saginaw Township, but if you want to get a hold of them, www.rmipc.net.